We're very excited to be here, and I want to thank everyone that's on this call. Suicide could be a hard topic to discuss, but the more we talk about suicide, the more other people are going to be talking about suicide. So, Annette and I really believe in this department. It was started right before COVID because the Mental Health Association saw the need to have a specific department around suicide prevention, because suicide affects every community. They say over 100 people are affected by each suicide. Annette and I literally go anywhere and everywhere to provide education, because the more we talk about it, the more we reduce that stigma, and the more likely someone's going to reach out for help, and the more likely someone will have a conversation with someone if they think they're struggling. So if you go to the next slide. Again, I'm so grateful for everyone joining us here today. Through education, through support, through resources, we could help people from dying by suicide. So here's what we're gonna cover. So we're gonna focus on the scope of the problem. So the next slide is just gonna be some statistics. We're gonna really talk about the state of youth mental health, especially in recent years with the pandemic. We're gonna be talking about risk factors. So what makes you more likely, or someone more likely, to attempt or die by suicide? And then we're going to be talking about those protective factors, which really can help build resiliency. We're going to touch on some warning signs. And then if you are concerned about a youth, how to start that conversation. Because, once we know what to look for, we need to know how to start that conversation, what questions to ask, and again, what resources are out there. So if you go to the next slide, here are some statistics. In New Jersey, youth suicide is the third leading cause of death. Again, I'm not going to read all these statistics. It's really just to show you how important it is to know what to look for, how to start that conversation. And again, we need to talk to our youth about mental health, about suicide, because they're already talking about it with their friends. And if we start talking about it to them, we normalize the conversation and we allow them to come to us if they are struggling, and feel comfortable with us if they're struggling. Next slide. I'm actually going to turn it over to my co-presenter, Annette, and she's going to get into a little bit more specifics of different populations.
Okay, thank you, everyone. It's a pleasure to be here. I just want to state, just transparency purposes, so I do have a PhD in clinical psychology. I don't have a license because I had kids and then I went back to the workforce, and so I'll probably be working on that. But I just didn't want anyone to think that I had a license to practice in that way, although I certainly do counseling and I do have a PhD. I just wanted to set the record straight. So in any case, so I wanted to talk about some recent trends that folks are seeing in the research in recent years, right? And we all know, we've all heard about a crisis for youth, and I'll get into that. But I wanted to focus on some recent findings that are causing concern. Okay, so one of them is the suicide rate among Black youth. So it used to be that Black youth had lower suicide rates, and white Caucasians had higher, but now those are the rate amongst the attempts and dying by suicide is increasing in recent years at a rather alarming rate. So, as the slide says, suicide death rates for Black American girls ages 13 to 19 increased by 182%. I mean, just think of that. It's just astounding. From 2001 to 2017. Black youths are 2 times more likely to die by suicide compared to their white counterparts. And it's such a crisis that the Congressional Black Caucus in 2021 has released a report on this. And the chairperson was Bonnie Watson Coleman, who is a congresswoman from New Jersey. And you can read that. You can just Google it. It's online. It's very revealing of some of the trends and some of their thoughts on what can be done to address this problem. So the rates for the suicide rates remain highest among whites, Native Americans, and Alaskan Natives are the highest. But as I said, you know, the rate of suicide among Black youth is really going up at quite an alarming rate. So if we go to the next slide. Okay, we also wanted to talk about LGBTQ youth and suicide. And those of you who are familiar with the Trevor Project, it's a nonprofit organization founded in 1998 to support youth, LGBTQ youth. And they did a large national survey that they just released in 2022. And some of the findings are highlighted here. 45% of LGBTQ youth seriously considered attempting suicide in the past year. Nearly 1 in 5 transgender and non-binary youth attempted suicide, and LGBTQ youth of color reported higher rates than their white peers. 60% of LGBTQ youth who wanted mental health care in the past year were not able to get it. And I can speak to that. So I work in suicide prevention. I also work for intensive family support services, and that program is grant funded by the state, and we provide counseling to families who are supporting an adult loved one who has serious mental health challenges. And I can tell you that the waiting lists, and even, you know, sitting in the ER for days, waiting for a bed, it's really, and COVID made everything worse. So there's a lot of there's a large a large demand, and the supply is not what we need it to be, and especially for kids, right? So there's nothing about LGBTQ that makes individuals more at risk for suicide. Rather, it's the degree of acceptance in an individual's family, school, community, which is the overriding factor mediating this relationship, right? And we'll talk later, we talk about protective factors. Connection, feelings of acceptance are key. It is the most important protective factor. So when we see things, you know, public policy in certain states, Florida, Texas, you know, these are not helpful to our LGBTQ youth. So we can go to the next slide. Okay, so we also wanted to talk about the relationship between suicide and mental health conditions, right? But we want to make it clear that most people who are coping with a mental health challenge do not attempt, they don't have suicidal ideation, they don't die by suicide, but the risk is elevated, right? About, you know, it's estimated that 60% of people who die by suicide have some sort of co-occurring mood disorder, major depression, bipolar disorder, borderline personality disorder is also associated with suicidal ideation and attempts, and anxiety, in particular, post-traumatic stress disorder and panic disorder are associated with suicide risk. And I also wanted to touch on, you know, looking at folks who deal with Tourette's syndromes, oftentimes can also have a co-occurring ADHD or an OCD diagnosis, and that's been shown also to have an elevated risk. I have a daughter who's ADHD, so I feel on very firm ground with talking about ADHD. And, you know, ADHD is associated with impulsive, right? Impulsive and poor, you know, somewhat poor emotional control for some folks. And, you know, that can lead to other things that are risk factors as well, but poor relationships and, you know, acting on an impulse, right? So And then the other thing that we'd like to let you know is that younger people who die by suicide often have a substance use disorder, in addition to being depressed. So folks will sometimes medicate their, mental health struggles in their own way. And the problem with that, I mean, there are many, but in terms of suicide risk, substances can reduce inhibitions, increase depressed mood, impaired judgment, lower impulse control. And those are all things that can put one at higher risk, right? So we can go to the next slide. Okay, so I wanted to talk a little bit about youth mental health in recent years, right? We're all concerned about this. 30 years ago, it was, drinking, drunk driving, teen pregnancy, right? We all remember smoking. Now it's youth mental health, right, is what everybody's thinking about. So here's some statistics in recent years from 2009 to 2019. The proportion of high school students reporting persistent feelings of sadness or hopelessness increased by 40%. The share seriously considering attempting suicide increased by 36%, and the share creating a suicide plan increased by 44%. And then we discussed some of the rates, particular to certain groups. So this has, been noticed, right, by folks, by mental health and advocacy folks, and so much so that the Surgeon General, Vivek Murthy, released a report, an advisory, and that was, I believe it was in December of 2021. And he talks about these issues and what are all the factors that go into youth mental health. And he also addressed some challenges that our youth are facing from the pandemic. And some of those statistics are below. 1 in 3 students reported poor mental health, 44 reported persistent feelings of sadness and hopelessness. 19.9% of students reported thoughts of suicide, and 9% made an attempt. So, I have 2 young adults now. My youngest just turned 18. I think, it threw them into this sort of, we all go along thinking that life is predictable. And if I do certain things, then everything will be okay. And all of a sudden we were all thrown into this unpredictable curveball, which shut everything down and isolated everyone. And that really, did a number on all of us, right? Connectedness is key, right? It is, like I said before, the strongest protective factor. So we want to think about these things. And also, there is cause for hope, right? So one of the things that Dr. Murthy points out is that, people who have experienced children who have experienced disasters, in history have rebounded. There is the potential with enough support and wraparound services, folks can rebound, right? And the data shows that. Okay. So then we want to move into risk factors. Oh, I just did want to say one other thing. So 2 other resources that I just wanted to point out. The American Academy of Pediatrics has also taken note of these trends and are trying to offer resources for parents, communities, and pediatricians themselves. So they released in spring of this past year a blueprint for suicide prevention. And you can find that on the American Academy of Pediatrics website. It goes into a lot of detail about programs and factors and all sorts of things. It's a really good reference for anyone who wants to know more. And that was a collaboration between the American Academy of Pediatrics, American Foundation for Suicide Prevention, and NIMH. Okay, so now we can go on to the next slide. I'm going to hand it back to Tracy, and she's going to talk about risk factors.
So Annette spoke about different statistics. I still can't get over that 44% of youth, the experience of sadness and hopelessness. And now that we know some of these statistics, what else do we look for? What else can we do? So here are some risk factors. And before I get into them, Just because you may have some of these risk factors, it doesn't mean that you're going to die or attempt suicide. It just puts that person at more of a risk than someone who doesn't have them. Just like there are risk factors for diabetes or heart disease, there are risk factors and warning signs for suicide as well. And again, you know, if you have some of those risk factors for diabetes, it doesn't mean that you are going to develop diabetes. It just means that you're at a greater chance than someone who doesn't. So if we look at some of these individual factors, so previous suicide attempt is one of the biggest risk factors for dying or attempting suicide again. Annette read the statistic about mental health conditions. Again, Annette already said this, but it's worth repeating. Just because you have a mental illness, it doesn't mean that you will die by suicide or attempt suicide. It just makes you, you know, more likely than someone who doesn't. So medical conditions, you know, medical conditions could be traumatic brain injury. It could be dealing with consistent pain. You know, when we're talking about children with tic disorders, there's a higher risk. You know, 23% had considered suicide at some point in their lives, which is a high statistic. Social isolation, Annette just spoke about connectiveness and support, so important. Substance use, you know, people use substances to self-medicate, you know, especially when we're talking about someone with depression or anxiety. Self-injury puts someone at a greater risk. Adverse childhood experiences, so that trauma when a child is younger, a loss, you know, and that doesn't have to be a loss of a loved one or a friend. It could be a loss of a boyfriend or a girlfriend. Bullying, a family history of suicide, family or peer conflict, barriers to healthcare. Annette was just speaking about this. You know, it could take months for you to get an appointment with a provider. Not only that, but sometimes, especially when we're talking about youth, you know, the logistics of getting there. So many times youth might come from a single family household and, you know, their parents work long hours, so they can't drive them, you know, or they might work 2 jobs. So there's different barriers to healthcare, the stigma. Again, that's why Annette and I love what we do, because we want to educate as many people as possible, because our hope is the more education that we provide, the more we talk about it, the more likely we are to help someone from dying by suicide. Access to lethal means. It's so important that, you know, we lock up prescription medications, that if we have any firearms in the house, to lock them up as well. Unsafe media portrayals of suicide, systematic trauma or marginalization. So we were talking about that when we spoke about African-American youth and the LGBTQ community. I actually attended this conference where there was a young lady from the Trevor Project who did this exercise where she told everyone to write down 10 things that are important to themselves in their life. So that could be a family member, you know, that could be ice cream, something that they love, something that they enjoy, something that's important to them. And then you start to take some away. And I remember that, you know, when you were down to those like top 3, she said a lot of times that's people that are important to your life. And sometimes, like Annette was saying, that lack of acceptance, you know, she said to take those 3 people away, and or the top 3. And how did that make you feel? And that's why connectiveness, support is so important, because a lot of times when people are in that community, they sometimes don't have that. So that was just an exercise to really show a little bit about how you could feel and talk about the importance of support and connectiveness. So if you go to the next slide, here are some warning signs. So acting reckless. I had my own struggles with suicide in the past. And, you know, I had many of those risk factors. I had a history of depression. I had many health problems, you know, so I had, you know, some of those risk factors for suicide, and the acting reckless piece was totally me. Talking about self-medicate, I use substances because I was like, whatever, who cares? You know, if anything happens when I act reckless, when I use substances, you know, I don't care if I live anyway. So who cares? I might as well do it all. Withdrawing from friends. So when we're talking about youth specifically, you know, if they don't want to hang out with adults or parents, you know, when we're at that age, I remember when I was at that age, even though it was a long time ago, I didn't want to hang out with my parents. I thought they were really uncool, but I did want to hang out with my friends. So when you see a youth withdrawing from friends, that's a red flag. It may not mean that they're suicidal, but it does mean that something's going on. So we want to have a conversation with them. Lack of self-care. So if they stop showering, if they stop taking care of their hygiene, that could be a sign. Not participating in activities that they enjoy. So if they enjoy football and all of a sudden they say it's stupid, or they're a cheerleader, or they're a part of the debate team, and all of a sudden they quit because they think it's stupid or boring, we might want to have a conversation with them. If they're looking for ways to kill themselves, if they're saying goodbye to loved ones, if they're talking about hopelessness, helplessness, you know, these are all signs. You know, if there's a change in their eating habits, so maybe they're not eating a lot, or maybe they're eating a lot. They say if you see, you know, 10 pounds gained or lost in a short amount of time, that can mean that something's going on. Again, it doesn't have to mean that someone's suicidal. It could be a physical condition, but, you know, we want to have a conversation with them. If they're sleeping too much or not sleeping at all, that could also be a sign. So, you know, especially when we're talking about youth, some of the other warning signs, agitation. You know, I felt like when I was young, I was agitated and angry all the time. Even with that sleeping too much. I remember when I was young, I used to sleep until noon. But it's that change in behavior that's really the important piece. So if someone, you know, is always hanging out with their friends, and now you notice that they're not, you know, it's that change in behavior. And again, you know, when we're talking about the agitation, when we're talking about the sleep, you know, it could be typical adolescent behavior, but it could be so much more, especially if we see, you know, a lot of these warning signs together. Okay, next slide. So protective factors, and I know that Annette touched on this before, and it's protective factors are so important. You know, we always say that they're sort of like bumpers on cars. They just like bumpers on cars, they absorb that shock in a car accident. Protective factors are things that really protect us from stress. And Annette said this earlier, contact with one caring, trusted adult is one of the most protective factors. So if you go to the next slide, I wanted to just talk about this a little bit because, you know, Annette and I get this question a lot, and really despite its complexity, suicide can be prevented. And I said this earlier when we spoke about risk factors. You know, just like there are warning signs and risk factors for other health crises, you know, like I said, like diabetes, there's also warning signs and risk factors that we can learn that can help us prevent someone from dying by suicide. And you play such an important part, and we all play such an important part. If we know the warning signs, you know, we all play an important part to keep young people safe, to keep people really safe in general. And again, everyone plays an important role. I always say, and people probably get sick of me saying this, that it takes a village when it comes to suicide prevention, and we all play an important role. That's why it's important to know what to look for and how to help someone and what resources are out there. And, you know, when someone, you know, we hear this a lot too, when, you know, someone asks the question, well, why did that person take their own life? And there's many factors that play in. You know, I just went over those risk factors, and it's not just one risk factor. You know, it's many risk factors that kind of converge and create this feeling of hopelessness and helplessness. I know when I had my own struggles with suicide, there was this overwhelming feeling that I had that things were never going to get better, that there was no light at the end of the tunnel. And no matter what, I never thought there would be. I thought everyone would be better off without me. I felt like a burden. You know, I felt like, and I didn't even want to talk about feeling suicidal to my family, because I felt like, well, this is just one more thing that I'm just going to throw onto their shoulders, which is so important. And I know we're going to get into this later, and that is about asking the question, you know, and if we are concerned, that's part of starting the conversation, is asking that question. Okay, next slide. Again, I said this earlier, contact with one caring adult, having that one trusted adult in a youth's life is so important. And that could be a parent, that could be a coach, that could be a teacher, it could be an aunt, it could be an uncle. But it's so important to have that one trusted adult. And Annette's going to get into this later on, but we always want to let the youth in our life know that they could come talk to us. Always be ready to listen. You know, whether it's about them feeling suicidal or them just struggling in general, it's so important that we let the youth in our life know that we're there for them. We're there to support them. You know, listening non-judgmentally is such a key factor, not only when it comes to suicide, but really in life in general. You know, listening can be really hard. And then when we talk about being non-judgmental, that could be really hard, especially I feel like as adults when it comes to youth. So that's why we want to be mindful, and we just want to listen to them. You know, we all want to be heard, and we all know when we're being listened to, and we all know when we're not being listened to. So listening, support, and hope is so important. Okay, next slide. I want you to touch a little bit about languages, you know, what we want to say, what we want to avoid. So we want to, because if we develop this baseline, this language, it could also reduce that stigma surrounding suicide. So we want to avoid saying committed suicide as it has a negative connotation. You know, when we think of committed, we think of committing a crime. And when someone's feeling this overwhelming feelings of hopelessness and helplessness, you know, we want to be mindful of that, because, you know, when someone's feeling like that, they feel like things can't get better. So we really want to be mindful of that. They feel like there's no other way out. So we want to use died by suicide. We want to not use suicide victim. We want to say person who died by suicide. And we don't want to say successful attempt, failed attempt, because when we think of success, we think of something good, and we never want to think of suicide as something good. You know, when I started many years ago in the field, we used to say completed suicide. We stay away from that too, because when we think of completed, we think of something good. And again, we never want to think of suicide as something good. So if we look at the next slide, this kind of goes along with the language piece. So we want to not only talk about the language you use, but we also want to get into some of the myths and facts. You know, and there are many myths when it comes to suicide that really could even stop life-saving conversations from ever taking place. So here are 5 of them. So myth 1, if people talk about suicide, they won't do it. It's just a cry for help. Don't believe that. Countless experiences tell us a different story. Some people may mention suicide, or some may talk about it often before taking any action. And I've never really personally understood, it's just a cry for help, so ignore it. If someone is crying out for help, why would we not respond to them? Myth 2, if people don't talk about suicide, they won't do it. And I know, yes, this is sort of strange because they're both opposite myths, but they're both true. I mean, they're both wrong. Because some people won't not necessarily divulge that they're suicidal. They might be having suicidal thoughts. Look at me. I didn't let anyone know that I was feeling suicidal. And I think it's important to remember that everyone is different. So that's why it's so important to know those warning signs and what to look for. So myth 3, talking about suicide will put the idea into people's heads and increase the chance of them doing it. This is probably the number one myth that Annette and I hear out in the community. And that's why I said earlier that, some of these myths may stop life-saving conversations, which again is why education is so important. That's why in the beginning, I spoke about how we need to normalize the conversation. We need to talk to our youth about mental health. We need to talk to our youth about suicide. So if someone is struggling, they could reach out. If we ask someone if they're suicidal, we're not going to put the idea in their head. If we ask someone if they're suicidal and they are struggling, take it from me, it's such a relief to talk about it, to talk about some scary stuff. So asking the question is not going to put the idea in someone's head. So myth 4, if someone seems down and they were talking about suicide, but now they're happy again, they must be over it. And that's not necessarily true either. Again, we're talking about that change in behavior. So if someone goes from being really sad to being happy, that could mean that they have come up with a plan on how to take their own life to stop that hopelessness, that helplessness, that pain that they're going through. If someone is self-harming, they won't be suicidal. Again, everyone is different. Some people may explain that their self-harm, an example of self-harm would be cutting, can distract them from their emotional pain. So it's sometimes suggested that suicide isn't a threat to people that self-harm, yet there is some research suggesting that because some of that intensity of that emotional pain they're trying to escape through self-harming puts them at a potential risk or a greater risk for suicide. So now that we kind of know the myths and facts, the language to use, the risk factors, the warning signs in youth, I'm going to turn it over to Annette to talk about starting that conversation, what you could say, what not to say, because that's kind of the next thing. Like, okay, I might be concerned about my child, I might be concerned about a youth, but what do I do next? So I'm going to turn it over to Annette to give you some tips about how to do that and what to say.
Okay, thank you, Tracy. Okay, so these are some general strategies of talking to your teen. So an ounce of prevention, right? So just general guidelines, and we'll get more specifically into asking questions about suicide if you're concerned. Try as much as you can to ask open-ended questions, right? This gives your loved one more of a chance to sort of steer the conversation, and you get more information, right? Don't rush to solve their problems. This can be very difficult. I have kids and 2 daughters, and when they have a problem, especially if it's one that has me concerned and emotional, right? Then I want to fix it, and I want to fix it yesterday. So so it is very tempting to say this is what you do because you want everyone to feel better. You want them to feel better. You want yourself to feel better. So, and it's as they get older, you can't act like you have all the solutions and that they're going to go with what you say, right? Because as they want to separate, as they get older, and you want to show them the respect of what do you think would help. And oftentimes just allowing them to talk through the problem, they'll end up perhaps at the same place, or they will have an experience of solving their own problem, right? And gaining that confidence that they can do that by talking it out, right? Be available and make sure your child knows it, right? So make yourself available. If you're busy doing something, your child wants to talk, you make time, right? If at all possible, you make time, right? Because part of what Tracy and I do is when we talk to kids, and we have a program for kids as young as 3rd and 4th grade, we want to let them know that, to encourage help-seeking behavior. You don't have to hide if something is really bothering you. There are people you can go to. Who would you go to? Who are the trusted adults in your life, right? And how do you take care of your mental health? What can you do? And we want to get them thinking that way, right, while they're young. So we don't necessarily talk about suicide in particular, but we talk about mental health. It's okay to talk about it. It's okay to reach out to someone to get help. Who would you, reach out to? What would be your own mental health plan that fits you, right? What are your coping strategies? So if we go to the next slide, tips for getting teens to talk, and this is individual to every family. You can have a teen-led family meeting, right? Let your teens set the agenda. Playing a game. If the subject comes up in a movie or TV show, out for a walk, that one works for me. And also taking a drive also works. Because there's something about driving in the car, there's less distractions, assuming they're not on their phone, of course. And also breaking a conversation down into small pieces, right? So not one big 2-hour talk, maybe it takes a few times of reaching out, right? And then enlist other trusted adults, right? Sometimes it's a grandparent, sometimes it's an aunt or uncle, sometimes it's a coach. Sometimes, kids don't always reach out to their parents or feel like they can't for whatever reason. So it's important to remember that there are other trusted adults in kids' lives that they can reach out to for help. Okay, next slide. Okay, ways to get started, right? So when you're having this conversation, right, if you're really concerned, it can be so anxiety provoking, right? To check in with yourself, right? And how anxious does this make me to ask this question? Because it's hard for parents to even go there, to think that this is a possibility for my kid, So here are some ways to get started. Recently, I've noticed, that you're not sleeping, or you seem, agitated. Are you okay? I just want to check in, right? How can I help, right? An open-ended question. And also, as Tracy was saying, is there someone else you feel comfortable going to? I'm here for you, right? And going and asking that direct question is important, because what you're saying to your child or the person that you're concerned about is, you're in a scary place, and without saying it, I'm asking you, I'm going to go there, I'm going to use those words, and I'm going to tell you that I'm ready to face this with you, right? And using the direct words will communicate that to them. So if we go to the next slide. Okay, and some things you can say that help, right? You're not supposed to know how to fix it. Would that we could, right? But you're there with them through this struggle, right? You're not alone in this. I'm here from you. I don't know how to go about this exactly, but we're going to figure out together, right? And I'm sorry you're feeling so bad. Okay. So it's sort of not, tying up their problem with a bow, because the way they're feeling, they're in such a place that they can't, there's nothing that will immediately fix the problem, right? So it's a struggle, and it's a marathon, right? So you need to communicate that you're there for them, and that you're going to be there for them through, whatever comes next, and that there are resources, right, to help. Okay. So if we go to the next slide. Okay, so what not to say, and I'll just say that when it comes to these kinds of things, parents have, we all do the best we can. We all have good intentions. So you might know that this could just be a phase. High school is terrible, but believe me, when high school is over, college is you get a whole fresh start. And you may be right about all of it, but they can't see it. And what they might perceive that you're saying is you just don't get it. You don't get how much pain I'm in. So it's important not to, without intending to minimize the place that they're at. You have to meet the teen, the loved one, or the person you're concerned about where they're at, right? They're in a different place than you are, right? Okay, so if we go to the next slide. Okay, and this is a video about just bringing up some of these themes and some tying them sort of all together.
I have my ups and downs, just like anybody else.
Maybe more than anybody else.
I can be hard to figure out.
And I like my privacy.
I don't want you looking over my shoulder all the time.
But you know your kid better than anybody else. And if you think he's acting different than usual...
Acting really down, crying all the time for no good reason.
Or getting really mad, not able to sleep, or sleeping too much.
Shutting her friends out or giving her stuff away.
Acting reckless, drinking, using drugs, staying out late.
Suddenly not doing stuff he used to love.
Or doing stuff that's just not like him.
It might be nothing to worry about. It might just be high school.
Or it might be something more. He might be depressed.
Not just feeling down, really depressed.
It might be that your kid is thinking about killing himself.
It happens. More than you think. More than it should.
And people say, I had no idea.
I thought it was just a phase he was going through.
I never thought she'd do it.
I wish he'd come to me.
I wish he'd said something.
I wish I'd said something.
When it's too late. So if you think your kid's acting different, if she seems like a different person, say something.
Say, what's wrong? How can I help?
And ask straight out. Are you thinking about killing yourself? It doesn't hurt to ask. In fact, it helps.
When people are thinking about killing themselves, they want somebody to ask.
They want somebody to care.
Maybe you're afraid you'll make it worse if you ask. Like, you'll put the idea in their head.
Believe me, it doesn't work that way.
It doesn't hurt to ask.
In fact, the best way to keep a teenager from killing herself is to ask, are you thinking about killing yourself?
And what if they say yes?
Or maybe.
Or sometimes,
Well, here's what you don't say.
That's crazy.
Don't be such a drama queen.
you're making too much of this.
That boy's not worth killing
Yourself.
over.
That's not going to solve anything.
You're just trying to get attention.
You're not going to kill yourself.
What you do say is,
I'm sorry you're feeling so bad. How can I help?
We'll get through this together.
Let's keep you safe.
A lot of people think about killing themselves. Adults and kids.
most of them never try it, but some of them do. So if your kid says,
I'd be better off dead.
I can't live with
I'm
this.
gonna kill myself,
Take her seriously. Find someone she can talk to about it. Someone who knows how to help.
Sometimes kids want to kill themselves because something happened. A breakup, a failure. But sometimes it goes deeper, and it's not going to go away by itself.
Get some help. Talk to your doctor.
Or a counselor at school.
Or your minister.
but don't just let it drop.
And make sure that your kid always has someone to turn to. Someone he trusts.
Make a list together, right then. 3, 4, 5 names.
Put a suicide hotline number on there too.
Have him keep that list in his wallet, so he always knows where to turn.
Make sure your home is safe.
If you have pills she could use to hurt herself, lock them up.
If you have a gun, don't just lock it up. Get it out of the house. The bullets, too.
And one more thing. If you think your kid might be about to hurt himself, don't leave him alone.
Take him to the emergency room.
Call 911 if you have to.
We all have our ups and downs, but sometimes it's more than that.
If you think something's wrong, the only way to find out is to ask.
Ask straight out. Are you thinking about killing yourself?
Don't wait until you're sure. Trust your gut.
Because it never hurts to ask.
And it can make a big difference. All the difference.
In your kid's life.
Okay. And I think there's such power in knowing that if you ask that direct question, it won't put the idea in anybody's head, right? So it's always important to ask. And this is like an infographic, and it's a new one because the suicide prevention line is now 988. So this is one that they've modified for that. So this is just guidelines. Ask, be direct, keep them safe, reduce access to lethal means. And I cannot stress how important that is, because for some people, look, no one, people do it in different ways or think about it in different ways. For some people, it's an urge and it comes on all of a sudden. So sometimes there's not a lot of time to pick up on it. So if you reduce access to lethal means, then that really can save a life. So, men, young men and teens, males are generally die by suicide at higher rates than girls. Now, girls will make more attempts, right, statistically, but boys they die by suicide more often. Why? Because they use guns, right? So if you, lock up your guns, if you have a lot of medication, it's lock it up. There is actually a program in New Jersey where you can, if there's, someone with a serious mental health challenge, you're concerned, you can actually have places to store it outside the house. If you go, it's operated through Rutgers University. And it's, I think if you just Google safe firearm storage on Rutgers, and Rutgers University, there's actually a map with places that you can go, some sporting goods stores and places like that. So it's very important because sometimes, like I said, it's an urge and you need to buy time, right? So that, you can intervene or delay long enough for the urge to pass. For other people, like Tracy was saying, sometimes it's, I've made up my mind, I have a carefully thought out plan, and they might even seem better, right? And that was true, if anyone's familiar with the story of Jamie Raskin, who's a congressman from Maryland. His son died by suicide on New Year's Eve in 2020. And he had been struggling with depression for quite a long time. But his dad, Jamie Raskin, thought Tommy was doing better. And so he talks about, I should have, looking back, I didn't use the word suicide, right? Even though, and he said, not talking to someone who's depressed about suicide is like not talking to your kid about sex, right? You think if I don't talk about it, it's just not a thing, but it's there. And you're not going to give anyone the idea, as Tracy was saying. Be there, listen, help them connect, right? And we have a lot of resources that'll be coming up in a slide or two. And stay connected. Just following up and checking in, right, is so important. And the research bears that out. Okay, next slide. Okay, so this is resources for learning more. Mental Health Association, we do have a website, Stop Teen Suicide, and there's our website at the top. The American Foundation for Suicide Prevention is an excellent source of information. Suicide Prevention Resource Center, National Alliance on Mental Illness, has a nice guide on navigating a crisis. NAMI New Jersey, right, that the state affiliate, and a lot of counties have their own county affiliate, and the Traumatic Loss Coalition, who I know presented in the last few years for you. Okay, if we go to the next slide. Excuse me. Okay, so I was saying before that there's now a 988 number, so you don't have to know that big long number. If you just dial 988, it'll put you right through. There's also Second Floor, which is a state number, a call or text. The Trevor Lifeline, which is a resource for LGBTQ individuals or those who love them. There's the crisis text line. You can text talk to 741-741. There are teen lines that are run by teens for teens, and they can be a good support, right, for someone who's feeling lonely and wants to speak to another teen. At MHA in the next couple of months, hopefully, we're getting our teen line off the ground, right, Tracy? And there's also this is also new, a NAMI helpline, which is Monday through Friday, 10 to 10, which you can call, chat, text, and email options. Okay. So those are some other resources to reach out. And also, if your loved one is a child in crisis, then Perform Care is you know, like a crisis for mobile outreach, right, for folks. Okay. And I'll also mention there's also a really nice app. It's called I'm Not Okay. And that is an app that if you have a loved one who is struggling with suicide, you know, who has that urge on a consistent basis, or feels like they struggle with it, you can put in there the numbers of support people in your life who are your trusted adults. And if you hit a button on there, I'm not okay, it automatically informs those people, I'm really in a crisis right now, I need some help. And it's a really nice way of reaching out when you feel like you're sort of at the end of your rope. Okay. On the next slide. Okay, and so this is just, excuse me, our contact information. So please do feel free to reach out to us with any questions. If there's any resources that you're confused about, or you want more information, please do feel free to reach out to us.
Families, thank you so much. Thanks both of you. And we do have questions here, a couple of questions. How old is too young to talk about suicide prevention?
So I think what we try and do is sort of make it okay to talk about mental health from a very young age, right? Make it okay to, and also model good mental health, model wellness yourself, right? And so that's for young ages. For older ages, my understanding is the research says by, I believe it's 6th grade, I think, if I remember correctly, kids know about that. Kids know about suicide. So certainly middle school, right? You can ask that direct question. We do a program in middle school called Signs of Suicide, because lots of the time, you know, friends will know that one of their friends is struggling and parents won't know. So we want to empower the kids, you know, horribly scary situation for anyone. What do you do, right? What's the next step? And we want to sort of give them the tools to talk about that. So, and then like I said, you know, for younger folks, we want to make it not stigmatizing, not threatening at all, to say, I'm struggling, I'm having a hard time. What can I do for myself, and who can I reach out to?
Thank you for that. Yeah, it's really important. I mean, you know, the suicide, particularly we talk about African-American youth, where that has increased, and it seems like the ages are getting younger. You mentioned 3rd and 4th graders. Why are we seeing an increase in suicide amongst that population, do you think, the younger population?
I think it is going up in younger populations. I'm not sure of the numbers. The 3rd and 4th graders, I was talking about a program that we do for 3rd and 4th graders. And it's this book for 3rd and 4th graders, and we read through it together and we talk about mental health struggles. But I don't know off the top of my head the statistics, but I know there is a concern, younger and younger. And there's, you know, the reasons for that is, you know, people suggest all sorts of things, right? Social media, or, you know, all sorts of things. But yeah, I mean, it's definitely true. And, you know, and as far as African-American communities, I think, you know, it's been a difficult few years, right? I think, you know, we talk about marginalized communities, and, you know, that's been a great concern with people with disabilities and African-American, you know, and it's just difficult. I have a daughter who has ADHD, and school was kind of rough for her. And a lot of it was social stuff, and the way she felt about that stuff. You know, it wasn't just focusing on a subject, it was all the other stuff. And you know, so I don't know if that answers your question exactly, but
that's fine. Does anyone have any other questions? You want to type it in the chat before we conclude? Please
And
pay.
Patricia, I saw someone wanted
A copy of the
to
presentation, yes.
know. Yes, so I will email that to you after this.
Okay, we'll get that out to everyone. We'll send you a PDF file with the presentation. Go back and look at it. And Annette and Tracy have graciously put their information in the chat so you can email them as well. We thank all of
And
you for
Patricia,
attending.
before we end, and
No, I have a
apologize for
survey I
just
want them to
cutting
take
you
too.
off.
No, I want them to take a survey. So don't leave everyone. You have to take our survey too.
Okay, and before we do that, I know Annette was talking about the programs that we provide for 3rd and 4th graders, and the evidence-based program we also provide for middle schoolers and high schoolers. We actually offer those programs free of charge. So if anyone's interested in learning more about them, please reach out to them, reach out to us, myself or Annette, and we could talk to you about getting it into your school. And again, it's free of charge. The 3rd and 4th grade program, we actually, and I know Annette touched on this, we actually give them a book to go home with and show their parents. And, it's a therapy dog. The book is, has dogs in them, which I feel like everyone loves puppies. So again, if anyone's interested in either of those programs, please feel free to reach out to us.
Thank you for sharing that, thank you so much.